Hello everyone, I'm Dr. Halasa, the founder and the author of Nitromedicine, and these are my team of doctors who adapt nitromedicine diagnostic and therapeutic protocols. What is nitromedicine? Nitromedicine is a new medical specialty focused on developing diagnostic and therapeutic protocols to enhance stem cells therapies and manage oxidative stress-related diseases by modulating nitro-redox-sensitive epigenetics and biochemical pathways. What are oxidative stress-related diseases? Almost all chronic diseases are oxidative stress-related diseases, which include chronic degenerative diseases such as Alzheimer's, chronic infectious diseases such as Lyme disease, chronic inflammatory diseases such as ulcerative colitis, autoimmune diseases such as multiple sclerosis, metabolic diseases such as diabetic mellitus, cancers, pain conditions. The common pathophysiology among all these diseases is abnormal redox metabolism, or high pathological free radicals, or high pathological redox potential. How we manage oxidative stress-related diseases. We use nitro-redox modulators to restore the nitro-redox balance, or restore the normal redox metabolism, or modulate the nitro-redox sensitive epigenetics and biochemical pathways. These nitro-redox modulators are biologics, such as stem cells, PRP, exosomes, probiotics, nutraceuticals, such as vitamins, TOs, polyphenols, nitroxide donors, CBD, pharmaceuticals, metformin, Radicava, steroid, NSAID, energy medicines, such as photomedicine, electromagnetic therapy, electromedicines. How we diagnose and monitor the efficacy of oxidative stress-related disease therapeutic protocols. We use oxidative stress markers, inflammatory markers, cancer markers, endothelial function test, ANS balance test, which is autonomic nervous system balance test, telomeres length, ratio of oxidizer to reduced glutathione. What is redox potential versus hydrogen potential? Redox potential is the affinity of the substance to attract electrons, and it ranges inside the cells between minus 100 millivolt to minus 100 millivolt. Hydrogen potential is the affinity of the substance to attract protons, and it ranges inside the blood between 7.35 to 7.45. Redox potential regulates almost all physiological processes in the body. It regulates the cell cycle, cardiac rhythm, circadian rhythm, brain neuroplasticity, ANS balance, receptor function, telomeres length, cancer growth. Drifting in the pH leads to acute conditions such as convulsion, confusion, cardiac arrhythmia, cardiac arrest, and death. But abnormal redox metabolism leads to aging and chronic diseases, and we can redefine them as oxidative stress-related diseases. As you can see, the G0 phase describes a cellular state outside of the replicative cell cycle. The cell redox potential at G0 phase is minus 400 to minus 300 millivolt. Physiological stressors or nitro-redox modulators such as growth factors, gravity, exercise, electrotherapy, prototherapy, and phototherapy, which increases the cell redox potential beyond minus 240 millivolt, stimulating cellular proliferation. When the cell redox increases beyond minus 220 millivolt, the cell stops dividing, known as the quiescent phase. And when the cell redox potential increases beyond minus 200 millivolt, the cells start differentiating, pathologically stressing the cells, and increasing the redox potential beyond minus 170 millivolt induces cellular apoptosis, and beyond minus 150 millivolt, it induces necrosis. This explains the photooxidation effect of photodynamic therapy, along with the oxidation effects of inflammation, chemotherapy, and radiotherapy, inducing cancer and microbial cell death. Photodynamic therapy involves the use of photochemical reactions mediated through the interaction of the photosensitizing agent, light, and oxygen for treatment of tumors and chronic infectious diseases. Basically, we inject the body with photosensitizers, which concentrate in the cancer or microbial cells, followed by radiating them with specific wavelengths of light. This causes electron excitation of the photosensitizers, reducing the oxygen into reactive oxygen species, therefore increasing the redox potential to the level that will induce apoptosis and/or necrosis. Nanotechnology shines a new light in anti-cancer and antimicrobial photodynamic therapy. Although the efficacy of photodynamic therapy has already been recognized, inefficient photosensitizers' uptake by cancer and microbial cells could result in insufficient therapeutic index. It is now clear that a nanotechnology-driven approach using nanoparticles can overcome this problem, increasing the efficiency and efficacy of photodynamic therapy. Nanotechnology has provided the possibility of delivering drugs to specific cells using nanoparticles. The overall drug consumptions and side effects may be lowered significantly by depositing the active agent in a morbid region only and in no higher dose than needed. This targeted drug delivery system is intended to reduce the side effects of drugs along with decreasing in consumption and treatment expenses. Drug delivery focuses on maximizing bioavailability both at specific sites in the body and over a period of time. Nanotechnology is one of the most rapidly growing fields of translational medicine. Its potential impact on photodynamic therapies is extremely wide. The convergence of photodynamic therapy and nanotechnology may provide new therapeutic modalities such as new photosensitizers formulations that are easy to apply throughout the body in a targeted manner. Several types of nanoparticle system have been studied to potentiate anti-cancer and antimicrobial photodynamic therapy with the aim of improving photosensitizer solubility, stability, and targeting. Compared to free photosensitizers, the encapsulation of the photosensitizer in nanoparticles shows several advantages. 1. Transport large concentration of photosensitizers for the production of lethal reactive oxygen species. 2. Enhance the solubility of non-soluble water photosensitizer. 3. Increases the targeting to specific cells and tissues and reduce the ability of the target cell to pump out the photosensitizers, hence reducing the possibility of multi-drug resistance. 4. Prevents the photosensitizers from metabolizing as it occurs in the free state. 5. Aselectivity of the treatment achieved through either passive targeting or by active targeting through charging the nanoparticle surface. 6. Encapsulation of the photosensitizers in the nanoparticles opens a new door of the treatment of cancers and infections with minimum side effects. Methylene blue is a molecule that has been playing important roles in microbiology and pharmacology for some time. It has been widely used to stain living organisms, to treat methemoglobinemia, and lately it has been considered as a drug for photodynamic therapy. The following clinical cases include treatments of skin basal cell carcinoma, skin squamous cell carcinoma, skin melanoma, protozoa, bacteria, virus, and fungal infections. This is a 40-year-old female diagnosed with cutaneous leishmaniasis. Managed with topical methylene blue photodynamic therapy using 660 nanometer LED red light. These are the before and after pictures and the publication supporting the treatment protocol. This is a 70-year-old male diagnosed with skin squamous cell carcinoma of the neck region. We managed this with topical methylene blue photodynamic therapy using 660 nanometer LED red light. These are the before and after pictures and the publications supporting the treatment protocol. This patient had been inappropriately prescribed and repeatedly used letrozone, which is a combination of a topical steroid and antifungal prior to presentation. She was experiencing marked discomfort and discoloration in the axillary region. Culture was positive for Candida. She did not respond to a topical butyrophene, so at the follow-up visit, she was offered a session of methylene blue photodynamic therapy. She had a significant response with resolution of her symptoms, and here you can see the before and after pictures along with publications to support the treatment protocol. This is an 80-year-old male diagnosed with distal and lateral toenail onychomycosis caused by trichophyton rubrum, managed with methylene blue photodynamic therapy using red light 660 nanometer LED. Here you can see the before and after pictures with publication to support the treatment protocol. In this case, a culture was taken from the wound site of the left shoulder on May 6, 2019. And was confirmed as MRSA. A single session of methylene blue photodynamic therapy was carried out on May 9, 2019, with complete clearance of the infection 2 weeks after treatment with no signs of recurrence. This patient presented with warts on the hand for over 12 years. 3 sessions of methylene blue photodynamic therapy carried out approximately 2 weeks apart. Initially appeared that the warts were unresponsive, however, 2 months later, as you can see here, MUS had resolved. This patient was diagnosed with skin nodular basal cell carcinoma with a treatment of 3 to 5 methylene blue photodynamic therapy sessions planned every 2 weeks. However, the patient was unable to attend after 2 weeks, with this photo taken 5 weeks after the first and only treatment. As you can see, there is a reduction in the size and rejuvenation of the surrounding skin. Upon dermoscopic images, treatment reveals a decrease in the characteristic telangiectasia normally observed in skin cancers. So we have here 60 years old patient with melanoma, skin melanoma. He's diagnosed recently, 10 days ago. And he has 2 spots, one in the right and left shoulder, and then he has basal cell carcinoma in his abdomen. And it's been biopsied and confirmed the diagnosis. And he start the sessions of treating it with methylene blue. I think this is the 7th session we're going to perform. And you have the pictures before. You can show the difference between before and after. I think before, the left side is around 5 millimeter, the right side is around 1 centimeter size. Now you can see after all the sessions, the wound is shrinked, the biopsy area, into 1 to 2 millimeter on the left side. And for the right side, it's around, you can say 2 to 3 millimeter. And I think the left side is grade 3 and the right side is grade 0. And we already cleaned it and scratched it. It's good to remove all the dead skin tissues and clean it with hydrogen peroxide. And then we can apply methylene blue, just a little drop of methylene blue on the site of the injury like this. Okay, and that's it, because it's only 1 to 2 millimeter wound. It's completely healed, and I think it's completely eradicated. We're just adding more to it. But you will see the area of the wound or lesion, it's stained very darkly blue because methylene blue attracts to inflammatory areas and cancer area and stains it, and it enters inside those cells, those cancer cells. And then we're going to leave it for 5 minutes or 5, and then we're going to after that radiate with red laser 660 nanometer or LED light if you don't have the laser, 660 nanometer. The power, you can go up to 5 watt power. That would be good. Up to if you have 30 watt, that's fine too. And you just apply it on the site of the lesion itself. It's good to add CBD because CBD does have anti-cancer effect too. So we're going to put some drop of CBD here. Just a little drop on it. Okay. And then we're going to shine the light for, you can say, 20 minutes to 1 hour, as you see here, and just put it directly on the lesion itself. And yes, and then the patient has Monday, he has a follow-up with a dermatologist and biopsy, and see if it's completely gone or eradicated, and I believe it's completely eradicated after 2 sessions. So we're going to keep you for 20 minutes, right? And I think this will conclude the presentation. Thank you very much.